Let's discuss the impact of COVID on ACS and stroke rates. There's a lot of concern now that, especially recently, that some people may actually be still suffering these events and just fearful of COVID-19 and opting not to go to the hospital. Can you touch on that a bit?
Yeah, actually, this issue, at least in my awareness, has cropped up only in the last couple of weeks. And we were hearing initially just anecdotes from the field that our ED and cardiac cath lab colleagues were noting a real drop in cath lab activations for STEMIs or acute coronary syndromes. The ED docs were seeing decreased arrivals of MIs in their emergency departments as well as acute strokes, and seemingly at much lower levels than what had been present even a month ago. So as we started to observe these trends and hear some of this conversation, we also had a group of investigators, with Tim Henry out in Cincinnati and a few of his colleagues, had a data set of fairly real-time data about cath lab activations at their various medical centers. And they put that data together just to understand if the anecdotes were actually tracking in an objective way. So they looked at cath lab activations across 9 different medical centers scattered around the United States, including Boston, Seattle, and then several Midwest centers. And they saw that, in fact, the anecdotes bore some fruit, that there's about a 35% reduction in cath lab activations in March relative to February. And as we know, March is really when COVID started picking up steam here in the United States, and all the social distancing and awareness strategies started to come into play. So the reason that this is happening, we're not sure, but certainly an enormous concern is that patients who are obviously acutely aware of COVID and concerned that hospitals are obviously going to be a concentrated place where COVID is going to be, that even if they are having symptoms that might be concerning of a heart attack or stroke, that they're scared to come out, that they think that, well, I don't want to get infected. That seems like a dangerous place. I'll just write it out here at home. And that's exactly the wrong conclusion we want people to have. Rather, what we'd like them to know is the same warning signs and actions that you should take in any time. If you're having chest discomfort consistent with a heart attack or some of the stroke-like symptoms, is to activate 911 EMS immediately and get that care. And the message that we're trying to put out to our patients through a press campaign this week is saying that we are prepared to deal with acute cardiac and neurologic events. And not only are we prepared to deal with that, but we're also prepared to help protect you from getting COVID infection while we're treating you. So, that message probably has gotten lost just in all the publicity around COVID. It makes sense. But now that we've recognized it, we're going to try and take some actions to improve that. The college has its own press strategy. We've also started talking to other sister societies in the cardiac and neurologic space to see if we need to have an even bigger concerted campaign around this, because that early data certainly is concerning.